Today I'm going to give you 11 really bizarre, wild vitamin D deficiency symptoms. Now, of course, most people know the usual vitamin D symptoms: lower back pain, depression, high blood pressure, inflammation, autoimmune diseases, things like that. But I will guarantee you do not know these. Now, let's dive in. Okay, number one, head sweating. Now, typically you'll see this in infants, but you can also see it in teenagers, adults. But if you notice like a child or yourself sweating just more in the head, suspect a vitamin D deficiency. Number two, sweating more at night, even if your temperature is cool. Now, this can also show up with your pillow being moist in the morning. So excess sweating, especially at night, is a vitamin D deficiency. Number three, mood swings. A person going from a condition or emotion of happiness down to feeling irritable, down to angry, and then they get sad, because vitamin D controls the regulation of your mood and it heavily influences emotions. And this has a lot to do with how vitamin D affects your brain. But if you notice that yourself or a loved one is just like roller coastering with these emotions, it could be a vitamin D deficiency. Number four, procrastination, being backlogged, and you just don't feel productive. I mean, it's pretty wild that someone's motivation is connected to a vitamin D deficiency. All right, number five, panic attacks. Now, in other videos, I talk about panic attacks being a vitamin B1 deficiency, and it can be, but you also have a vitamin D connection to this as well. A panic attack is a very severe fear or a very high anxiety condition. And it definitely relates to certain hormones and neurotransmitters like serotonin. But for those people out there that have panic attacks, resort to drugs, they might want to consider trying high doses of vitamin D3. Number six, achiness in your pelvis, in your lower back, in your hips, and your upper legs. Vitamin D is intimately connected with the formation of bone. And one symptom of that is literally pain, but not sharp pain, this achiness that's the inside of the bone, because that's where you're losing the bone, on the inside. It's sad because it's so easy to fix, but you would have to take higher amounts, not lower amounts. I'm talking like 10,000, 20,000 at least. If you have any concern about 20,000 IUs of vitamin D3 being toxic, I just want to let you know that being out in the sun in the summer for 40 minutes will give you 20,000 IUs of vitamin D3. Is that toxic? No. 200,000 IUs of vitamin D3 taken over months. That's when you get into the toxic effect, not 20,000 IUs. So then we have number seven, which is loss of muscle strength. Vitamin D has a direct effect on calcium itself. And without vitamin D, calcium is going to be deficient in the muscle. Calcium allows the muscle to contract, but not only contraction, it's also involved in the production of muscle itself. So without vitamin D and calcium, you cannot create muscles. And we also get this weakness within muscles that control power and strength, primarily your legs and your shoulders. And on top of that, vitamin D also controls and regulates pain. Number eight, stiffness. And the stiffness usually occurs in the knees and in the fingers. And of course, this definitely relates to inflammation, but it also has to do with what vitamin D does to your cartilage and your collagen. So you might find that when you stretch backwards and create tension on the cartilage in your breastbone, you might feel stiffness in that area as well. And that can also affect breathing, things like that. Number nine, chronic fatigue. This has a lot to do with those little energy factories in your cell. They're called mitochondria, and how important vitamin D is to support that little factory. And if you don't have enough vitamin D, you just can't make energy. Number 10, your ability to think quickly is diminished. Basically, you have too many applications open on your desktop computer, but related to your brain. And number 11, it's just very difficult to be satisfied when you eat a meal. It could be that the food is just nutritionally empty and you keep eating to get these nutrients. It can also be certain things in the food that cause you to be addicted. But if you're low in vitamin D, you're just not going to feel satisfied. You will definitely have a tendency to overeat. Vitamin D deficiency is the number one cause of osteomalacia. I think this is going on in a massive scale in society right now, but they have a subclinical version of osteomalacia because I was eating poorly, and I know I had a vitamin D deficiency, and I started getting fractures. You have to realize that vitamin D, controls calcium absorption by 20 times in the small intestine. It would take at least 10 1,000 to 20,000 IUs per day until you can get your levels a little bit higher. For this bone problem,